I'm Dr. Christopher Barker, a New Jersey licensed clinical psychologist, and welcome to Holding Space. This is a place where we talk about psychological topics that might be of interest to you. We talk about the process of going through being educated in psychology. We talk about everything from autism to bipolar disorder and onward. I frequently wind up talking about complex trauma because it's something that I see a lot of. It is something that I personally have experienced, and this is something that it takes years of therapy to undo. Why? Because it's subtle, because it gets in early, and it changes a lot of things. So when you talk about relationships, I heard someone talking about this recently. Why didn't I see the red flags? Why didn't I see that coming? Raise your hands if you've heard that before, or raise one hand, raise both hands if you've said it yourself. And I think part of the reason is because complex trauma sort of makes us immune to seeing danger signals. How does that happen? Okay. When we have complex trauma, especially that beginning in early childhood, red flags don't look red at all. They can be confusing, familiar sometimes, or even comforting because it's what we know. This presentation is going to explain why we see it this way. What is complex trauma? Okay, complex trauma refers to repeated or chronic exposure to emotionally harmful experiences. It often occurs in childhood, typically involves caregivers or close relationships because they are the ones who can get in the farthest. They are the ones who can get closest. Examples include emotional neglect, parentification, if you've been made into the parent and your parent is more like the child. Unpredictable caregiving, if you don't know when you're going to be getting care. If the other person does not have any idea about how to let you know that things are okay, you're always waiting for that other shoe to drop. You're always waiting for something to happen, and you're not sure when it's safe. We can have chronic criticism or invalidation that results in complex trauma, exposure to conflict, addiction, or instability in the family relationship, and all of this being as common as it is, we have to wonder that we don't see more of it. Chronic criticism or invalidation, exposure to conflict, addiction, instability. And since we hear about so much of this in families, we wonder why it's not more common than it is. Perhaps it is. Perhaps it is more common. How trauma rewires our relationship radar. Familiarity feels safe. That makes sense. When chaos, inconsistency, or emotional unavailability were normal and what we were raised with, the nervous system may interpret similar dynamics to the home environment, to what we've always known. So red flags feel familiar. Red flags, familiarity feels safe. Therefore, red flags don't register as danger. It isn't a failure of judgment, it's conditioning. And I've been writing about this frequently on LinkedIn recently, and I'm going to have a guest on probably next session that will talk a little bit more about this. But part of it is in how we have conceived of ourselves, and part of it is what we tell ourselves as life goes on. We shape ourselves. As I said in one of my previous podcasts about reinventing reality all the time from a subjective standpoint, our brains are complex that way, and they want completion. They want to see things in a sensible way. And if the only sensible way is to see conflict, then, well, we're going to continue seeing conflict and basically be at home with it, not run away, as we should. With complex trauma, you hear about hypervigilance. And it is hypervigilance that you experience because you're waiting for that other shoe to drop, but it's not about ourselves. People with complex trauma often scan for mood shifts in other people, anger, withdrawal, signs that someone else is upset. And what we usually try to do is use what Terry Real calls the adaptive child, and we try to fix it. And we try to make it better for them. But we may not be scanning for our own discomfort, our own boundary violations, our own emotional needs. These are things that we may neglect. Hypervigilance is outward, not inward. We're not we're not keeping a close eye on ourselves and what we're feeling. Attachment patterns influence perception, and we frequently talk about attachment patterns as impacting complex trauma and vice versa. Anxious attachment can come from trauma. Red flags get minimized because the fear of abandonment is louder than the fear of harm. That voice inside your head that says they're going to walk away and leave me is scarier than I may come to harm. Or I can ignore some of the things that they've done because I don't want to lose them. Avoid an attachment. Red flags get ignored because closeness itself feels threatening. So you'll have a relationship on a sort of a superficial level, but you may not have as much depth. Closeness itself feels threatening. Disorganized attachment. Red flags feel both dangerous and magnetic, creating confusion. You may feel drawn to the person. You may also feel terribly frightened by the person, and so you remain stuck in a sort of stasis, what they call freeze, in the fight, flight, freeze, fawn method of looking at relationships and attachments. You may even fawn to try and keep that person's attention, to keep that focus. Trauma teaches us to normalize the abnormal. If you grew up with yelling, silent treatment, emotional inconsistency, lack of boundaries, chaos, as I mentioned before, caretaking roles, then these behaviors may not register as problematic in adulthood. They feel like just how relationships are. Psychological mechanisms that hide red flags, well, like I said, fawning, a trauma response where you over accommodate, you minimize your needs to avoid conflict, you try to fix or soothe other people. This makes it easy to rationalize harmful behavior. Cognitive dissonance is another factor. When someone shows both affection and harm, the brain tries to resolve the contradiction by excusing the behavior, blaming yourself. Oh, it's something I did. And more than likely, you're involved with someone who has a lot of red flags, then they'll probably be blaming you too. Focusing on the good moments. Oh, well, but everything was so good. And it's not right now, but that's okay. It'll get better. This is especially strong if inconsistency was part of your early relationships. Low self-worth. Yeah, this is a big one. This is something that we frequently learn in childhood. Trauma often plants beliefs like, I'm too much. I should be grateful that someone loves me. If they're upset, it's my fault. These beliefs make red flags feel deserved or insignificant. Emotional numbing. Some people disconnect from their own emotional signals. They can't feel anger as strongly as the average person. Maybe not even discomfort. Fear, intuition, these things get turned down in volume. It's harder to recognize danger. Now, why red flags can feel like green flags? Chaos feels like chemistry. The nervous system may confuse adrenaline with attraction. They're frequently both involved. Anxiety with excitement. To be anxious before a date or to be anxious when, your loved one is coming home, normal up to a point, but it all should also feel comforting. And if it's an abusive relationship or if it's a red flag relationship, you can feel comforted even when you probably shouldn't. We confuse unpredictability with passion. This is trauma reenactment. It's not intuition. Caretaking feels like love. If you learn love equals fixing, soothing, or rescuing, as I mentioned with the adaptive child, then controlling partners feel strong. Emotionally unavailable partners feel like a challenge that you just have to get in there and make them feel better. Volatile partners feel like someone you can help. How often have you heard someone say, oh, I can fix him? Unique fixer-uppers are really not a bargain. You learned as a child to work for love. When love was conditional, you may unconsciously choose partners who require proving yourself, who require earning affection, They require chasing validation. Red flags get reframed as opportunities to finally get it right. And, the old saying about what is the definition of insanity? Doing the same thing over and over again, expecting different results. Freud talked about repeating patterns and not having any new tools and not examining ourselves so that we don't know why we're doing what we're doing. So, not exactly insanity, it's just a repetition of what we know. How to rebuild a healthy relationship radar? Well, I wouldn't tell you about a problem without telling you something that might help fix it. But you have to reconnect with your internal signals. Notice your body's sensations. What is your body telling you now? How are you feeling? Is there anxiety? Where is it in your body? We talk about this a lot with somatic experiencing. We talk about this a lot with EMDR. Where is it in your body? Identify the discomfort early. We learn to look for the first signs of it. When those first hairs go up on the back of your neck, that's something to pay attention to. And we have to practice renaming emotions. We have to practice naming them for what they are. We have to learn what healthy actually looks like. Many people with complex trauma have never seen consistency. They have never seen respect. They haven't seen emotional availability. They haven't seen repair after conflict. There's a story I like to tell about a couple that I was working with that they would have a fight and they just never fixed it. They would just go downstairs and make a sandwich. And that's not a way of fixing things. It just makes it go away temporarily, but it doesn't come to a real resolution. Learning how to do these things helps you calibrate your expectations. Slow down the pace. Trauma bonds form quickly. If you are trauma bonded with someone, odds are there was like love at first sight, and it may feel very romantic and it may feel strong. It's really just recognition. You're seeing again the things that you knew. Healthy relationships unfold gradually. Build boundaries as data points. When you set boundaries, people reveal their respect, their emotional maturity, their capacity for partnership. If they resist your boundaries, that is a red flag you should pay attention to, and you should work harder at keeping that boundary. Seek support, therapy, support groups, trauma-informed education. We'll talk more about trauma-informed another time. They can help you understand the patterns, build your self-worth, develop secure attachment skills. These things are all really important, and these are things that I think we need to pay more attention to. We need to look at the impact that our early upbringing has had on us and how we can see the patterns repeating. Sometimes just being aware of what happened before and how it has impacted you can make a difference in processing a current relationship breach or in processing a current relationship that is just forming. I am Dr. Christopher Barker, and thank you for holding space. We will continue with more about trauma-informed language. We will continue more about complex trauma. But for now, thank you, and have a good day.